So welcome Dr. Sunder Rajan from the NMC Specialty Hospital in Al Nada. So what are the symptoms of sinusitis?
Sinusitis is a disease that affects the nose. So most of the symptoms are related to the nose. So it's either nasal blocks or postnasal drip. Postnasal drip is basically secretions dripping into the back of your throat. Or you could have congestion of nasal stuffiness and diffuse pain over the face, especially over the jaw. Sometimes bad smell. Some people can perceive an abnormally bad smell, or they might not be able to perceive normal smell. So we call it as anosmia or hyposmia. Usually a combination of two or more of those symptoms are pointed towards sinusitis.
Okay, so are there different types of sinusitis?
Yeah, sinusitis is based upon the time frame of the duration of symptoms. Sinusitis can be either classified as acute sinusitis or chronic. Acute sinusitis is those sinusitis for which people come to the clinic frequently, when they have a cold and when they have fever and nasal blocks and all that. That's acute sinusitis. Chronic sinusitis is sinusitis which stretches on for more than a couple of months. These people usually have on and off nose blocks and fall sick with repeated sinusitis. Whenever the weather changes or when they drink cold water, they fall sick with throat pain, nose blocks. Those are the people with chronic sinusitis. Also based upon what the organism which causes sinusitis can be classified as viral, bacterial, fungal, or even allergic sinusitis. So there are different types of sinusitis based upon the cause as well as the duration.
All right. And then what are the roles of antibiotics in sinusitis?
Well, antibiotics are useful only in one type of sinusitis called bacterial sinusitis. Almost in all the other types of sinusitis, they don't have much of a role. And statistically, 1 in every 10 cases of sinusitis is bacterial, so which means that the role of antibiotics is very minimal. But unfortunately, the other way around in practice, most people expect antibiotics to be given for sinusitis. But the importance here is that because of the resistance, people should understand that they shouldn't probably demand antibiotics when they feel that they have sinusitis. They should go to the clinic and ask for sinusitis. There should be a lot of conservative when it comes to antibiotic prescriptions in sinusitis.
And what is the role of surgery in sinusitis?
And those who suffer from chronic sinusitis, because the bones are affected. So for most patients of chronic sinusitis, we do a surgery called functional endoscopic sinus surgery, wherein we open up the openings of the sinuses, clear the secretions from inside the sinuses. And this indirectly promotes aeration of the sinuses, so allows air to get into the sinuses and restores them back to normal position. In chronic sinusitis, surgery has got a very big role to play, and it might really be a life-altering surgery for most patients who suffer from chronic sinusitis. Acute sinusitis, the role for surgery is very limited, but occasionally when there are complications of acute sinusitis, when there are abscesses or when spread to the eye or brain, we might resort to surgical procedures to get rid of these.
Thank you. Now, how safe is the surgery and how effective is it?
Well, with the advancements in technology, including imaging and various endoscopic instruments and all that stuff, surgery nowadays is generally very safe because we have a lot of things which guide us during surgery to make sure that we do not stray beyond the nasal and sinus boundaries.
So can sinusitis be dangerous?
It can. If you remember when I was talking about acute sinusitis and surgery, I said sometimes when it spreads to the brain or orbit. Sinusitis can sometimes spread beyond the confines of the sinuses. It can spread into the eyeballs to protrude out. It can cause brain fevers. But these are getting more and more rare with the advancements of medications, early diagnosis, and even surgical treatments to get rid of these problems much before they reach that stage.
Okay, Dr. Sunder Rajan. And how can we actually get in touch with you?
Well, we are the NMC Specialty Hospital. We are located in Al Nada 2, Dubai, and we are there in the net at www.nmc.ae.